Today we're going to talk about three main components that involve chronic pain, which need to be addressed before we dive into any of the deeper things. So, three main pieces that a lot of people overlook: trainers, PTs, other people, right? When it comes to chronic pain, yes, we're going to look at the nervous system, we're going to look at the fascial system, the muscular system, the lymphatic system, all these other systems. Everybody has a different approach. Everybody's got a different thought process. But what we really need to understand, especially if you're working with gym goers, athletes, anybody of the sort, even if you're working with people that just work at a desk all day, right? The load, the position, and then the neural tension, or the neurological loading and neural tension, right? So these are the three main components. They all work together usually. You may have one, but if you have one, it may tie directly into another one. And so what we're talking about, so if we think load, right? So if somebody can't load themselves up properly with a weight, or they feel weakness doing bicep curls, and they complain about shoulder pain, and they complain about neck pain or shoulder arm pain, a lot of the times it's probably not necessarily shoulder pain as much as it is either a weakness because of neural tension, which means that there's a muscle or an inflammation or an impingement or something that's pressing a nerve that you may not feel immediate or drastic pain from, but you feel a chronic weakness. One just fatigues all the time. Doesn't fatigue in other movements, but it's just the same movement. So if that's the case, we might look at the position. So if somebody is standing up and they're doing bicep curls and they're fatiguing and they're getting weak from that bicep curl, well, in a standing position, we have gravity that's pushing down, right? We're activating our neck to hold ourselves up. We're activating other components of the neck, shoulders, arms, back, chest area. If we take them out of the standing position and put them into a supine position, lying on their back or on their table, and we reassess that curling motion, they may be strong in that position, which then would tell us that it may not actually be anything serious. It may just be the load and the position. So the load could be pressing on a nerve or causing neural tension in the standing position. And so when we take them from that standing position to a supine position, they can do the same movement. But now if we're lying, gravity is pushing down here, taking all of that tension off of my neck, my traps, my shoulders, my head is relaxed, my head's not pushing down, right? 16 pounds or 20 pound head pushing down. And so we want to make sure that we're understanding that, yes, stretching is great, yes, massage is great, yes, chiro is great. They all have a time and a place, but the underlying component for a lot of chronic pain, what we want to look at is either load, position, or neural tension, or all three. All right? So if somebody's super close and they don't feel any pain, but as soon as they extend their arm, they can't grab, they can't grip, well, we're going to look probably at a neural tension issue. In this extended arm position, what else is being used where possibly there is more neural tension on one of these nerves or multiple nerves that is causing this weakness or this level of restriction? And so when they're here, they can grab stuff and do stuff perfect, but when they extend, we now have more neural tension. And so that may take us into soft stretch, right? It may allow us, when we're stretching and we're intentionally focused on the nervous system, which is what we do with SRT, we're working to downregulate the nervous system. So if there is a neural tension, soft application, soft stretch, soft myofascial release work, and soft, slow tissue mobilization in and around those joint areas can have a very dramatic effect on relieving that neural tension and opening up some blood flow, opening up some space within the joints, and opening up that release through the fascial lines. Now, I know there's a lot of people that look at the muscles, then there's a lot of people that look at the fascia, then there's a lot of people that look at the skeletal system, but it is all connected. And so if we know that close is okay, shortened, contracted is okay, but extended or stretched, maybe pressing more along a nerve line, or that fascial restriction in an extended position is a little bit tighter. Well, we can work on slowly mobilizing tissue in and around the shoulder, because a contracted state feels okay, but when we're extended, we're more in a stretched state. So we don't necessarily have to stretch in what people believe the context of stretching is: forceful, aggressive, pull this, do all of this nerve gliding, different components. We don't need all of that. We just need to understand that in a certain position, there may be more neural tension that's affecting their mechanics physically. So again, taking them from a standing position to a supine position, can they reach up towards the ceiling with no pain? Does it feel better, stronger grip? Awesome. So what we need to understand is when we're looking at the SRT approach and we're looking at the philosophy, we are looking at understanding the nervous system. Guys, how does your nervous system affect your muscular system and these other pieces or these other systems at play? Okay, a lot of the times what you're feeling or what your client is feeling, hamstring tightness, very rarely is it actually a true hamstring issue. Unless there's an injury to that hamstring, most of the time it's going to be a hip capsule, a lower back issue, tightness through those two areas, or restriction in those two areas, or a shift in the hip capsule, right? You might need a posterior glide or an inferior glide to free up some space. And then when we do that, we release the fascial pull, we release the tension, and then we have better movement. And the mechanics function more appropriately. And so it's never really truly a hamstring issue for a lot of people. So this is the thing, you guys, I want you to remember. If you're interested in more videos, please subscribe to the channel. As always, you can check us out on Instagram, SRT_therapy, SRTtherapy.com for all of your live clinics, or to enroll in our online academy. We have that up and running, and we will see you in another video.